Has someone you love started showing subtle, yet concerning changes over the past year? Many people assume that death in old age happens suddenly. But the truth is, the body often begins sending quiet warnings months, sometimes even a year, before life reaches its final stage. The problem is, most families miss these signs. They seem so small at first, so ordinary, that no one realizes their importance until it's too late. And only in hindsight do people look back and recognize that the clues were there all along. By then, it's often too late to prepare, too late to make those last memories truly count. In this video, we're going to talk about 5 key signs that often appear in the year before an elderly person passes away. Some of them might be things you've noticed but brushed off as just aging. Others may seem minor, yet they are actually signals of the body's gradual decline. Recognizing these signs early gives you the chance to provide better care, cherish more meaningful moments, and, most importantly, ensure that your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us until the end, because these 5 signs can help you prepare both emotionally and practically for what lies ahead. When you understand what's happening, you won't be caught off guard, you'll be ready to make the most of the time that remains with those you love. Now, let's begin. Number 1, significant weight loss. One of the earliest and most telling signs that a person may be approaching the final year of life is unintentional weight loss. At first, it may seem subtle, a belt that suddenly needs tightening, clothes that feel looser, or a once hearty appetite that begins to fade. Families often dismiss this as just normal aging. But in truth, losing weight without trying is rarely a harmless sign. It often indicates that the body is no longer absorbing nutrients efficiently, muscle mass is decreasing, and essential systems are slowing down. Aging naturally brings some muscle loss, yes, but when it happens too quickly, it points to something deeper. The body may be struggling to digest food properly or unable to process protein effectively, leading to muscle wasting. This loss of strength not only makes movement difficult, but it also increases the risk of falls, weakens the immune system, and leaves the person vulnerable to infections. Another reason for this decline is appetite change. Many elderly individuals simply no longer feel hunger the way they used to. Their sense of taste fades, food no longer brings enjoyment, and they begin skipping meals or eating much smaller portions. This isn't just preference, it's a physiological change. The body, sensing that it is shutting down, no longer signals the brain to seek food. The result, less energy, less strength, and a gradual overall decline. Underlying medical conditions also play a role. Weight loss is common in chronic illnesses such as cancer, heart failure, or kidney disease. Even depression or cognitive decline can reduce eating, creating a downward spiral where the body isn't receiving the fuel it needs to sustain itself. Families often respond by encouraging their loved one to eat more, offering favorite foods or adding protein shakes. But if the weight continues to drop despite these efforts, it's important to realize that the issue may not be diet, it's the body preparing for a deeper transition. At this stage, forcing large meals may not help. Instead, focusing on comfort, easy-to-eat foods, and hydration can make a bigger difference in maintaining quality of life. So if you notice significant, unexplained weight loss, especially when it's accompanied by weakness or less activity, it's a sign to pay close attention. This isn't just about appearance. It's the body sending a message. And understanding that message now can help you prepare for what's ahead with clarity, compassion, and purpose. Number 2, extreme fatigue and weakness. Another striking change that appears in the year leading up to life's end is deep, persistent fatigue. This isn't the usual tiredness that disappears after rest. It's a profound exhaustion that lingers, making even simple tasks overwhelming. Getting out of bed becomes a challenge, walking across a room requires effort, and once routine activities like cooking, dressing, or even holding a conversation feel draining. This isn't just old age. It's the body conserving its remaining energy. As organs slow down, the body starts prioritizing only what's essential. The heart pumps less efficiently, circulation weakens, and muscles receive less oxygen than before. Metabolism also slows. Instead of fueling activity, the body shifts toward preservation. That's why seniors in decline often start sleeping more, needing long naps during the day, and struggling to stay awake for extended periods. Some may even have sudden energy drops, fine one moment, completely drained the next. The emotional impact is perhaps the hardest part. Seniors who once valued their independence can feel frustrated, even embarrassed, that they can't do what they used to. Many withdraw from conversations, avoid social settings, or stop engaging in hobbies, not because they don't care, but because they simply lack the energy. For families, it's painful to watch a once active loved one become exhausted and withdrawn. But it's important to understand, pushing them to try harder won't help. What matters most is recognizing their limits, allowing them to rest, and focusing on comfort. If you notice ongoing fatigue that doesn't improve with rest, it's a sign of the body entering a major transition. This is the time to cherish quiet conversations, create moments of peace, and let them feel understood and supported. Because in the end, what matters most isn't how much they can do, it's that they feel loved, respected, and at ease. Number 3, increasing confusion or withdrawal. As life nears its end, changes in the mind and emotions often become strikingly clear. You may notice a loved one who was once sharp and engaged begin to forget more often, lose track of time, or even become disoriented in familiar places. They might repeat themselves, forget names, or struggle to follow conversations, even if they never had memory issues before. This isn't normal forgetfulness. The brain, like any organ, requires oxygen and nutrients. As circulation weakens and oxygen flow decreases, the brain struggles. The result, confusion, difficulty making decisions, and even trouble recognizing people they've known for years. At times, there may be brief moments of clarity, followed by sudden disorientation, like their mind is fading in and out. Emotional withdrawal is also common. A once social person may begin speaking less, engaging less, or simply sitting quietly in silence. It's not that they no longer care, it's that their brain no longer processes interaction the same way. Conversations become tiring, loud environments overwhelming, and eventually many retreat into their own inner world. Mood changes may also appear. Some become irritable, anxious, or easily frustrated. Others grow calm, detached, or indifferent. These shifts aren't personality changes, they're the brain responding to the body's decline. For families, this stage is often heartbreaking, watching someone slip away emotionally before they're gone physically. But it's vital to remember, this isn't within their control. Instead of forcing engagement, the best gift is patience, gentleness, and reassurance. Even when words fade, love can still be felt. If you notice confusion, forgetfulness, or withdrawal in your loved one, don't dismiss it. These may be early signs of the body preparing for its final stage. The best response is to create a safe, familiar, and peaceful environment, one where they feel secure, loved, and calm. Number 4, frequent infections and slow healing. Another clear physical sign of decline is a weakening immune system. Someone who once rarely got sick may now catch every cold or flu that comes around. What used to be minor illnesses take much longer to heal. Small cuts, bruises, or sores may linger without closing, or reopen again and again. This happens because the body can no longer defend and repair itself as it once did. Repeated infections, pneumonia, urinary tract infections, skin or oral infections, become common. Families often see these as isolated problems, but when they happen frequently, it's often the body showing it can't fight back anymore. Even antibiotics may seem less effective. Treatments that once worked quickly may now take longer or fail altogether. This isn't negligence, it's simply the body no longer responding to medicine as strongly. Poor circulation makes things worse. If blood flow slows, oxygen and nutrients can't reach tissues properly. This makes healing wounds much harder, raising the risk of dangerous sores and infections. What's especially important to know is that infections in elderly people don't always show in obvious ways. Instead of a high fever, the first sign may be sudden tiredness, confusion, or a loss of appetite. Watching this decline can be frustrating for families. The instinct is to push for more treatment, hoping another hospital visit or medication will fix things. But often, the focus begins to shift from curing to comforting. Simple steps, hydration, keeping the skin clean, reducing stress on the body, can matter more than endless treatments. At this stage, the goal is not just survival, it's preserving comfort, dignity, and peace. Number 5, major changes in breathing or circulation. One of the clearest signs that the body is preparing for its final stage is a change in breathing patterns and circulation. You may notice slower or shallower breaths. Sometimes, pauses appear between breaths, or breathing becomes irregular, alternating between fast and slow. A pattern known as Cheyne-Stokes breathing may emerge, where deep, rapid breaths are followed by long pauses. Circulation also weakens. Hands, feet, nose, and ears may feel cold. The skin may turn pale, bluish, or mottled, especially around the fingers and toes. This happens because the heart is no longer pumping blood strongly, redirecting it only to vital organs. Shortness of breath can also increase. Tasks like sitting up, speaking, or moving slightly may cause them to feel winded. Fluid in the lungs may create coughing, gurgling sounds, or chest tightness. While families often think it's just a cold, in reality it's a sign that the lungs and heart are slowing down. For loved ones, seeing these changes is frightening. The instinct is to encourage deeper breaths or seek urgent help. But often, these shifts are a natural part of the body slowing down. Comfort becomes the focus. A cool room, a humidifier, small sips of water, or sitting propped up on pillows can ease discomfort. Sometimes, oxygen therapy or medications may help, but the goal is no longer to fix, but to bring peace. If you notice these signs, irregular breathing, cold hands and feet, bluish skin, it's a signal that energy is fading. This is the time to stay present, offer reassurance, and surround them with calm. In these final months or weeks, the greatest gift you can give isn't medical, it's your love, your presence, and the assurance that they are not alone. Final thoughts. As we close, let's reflect on what we've discussed. Significant weight loss. Extreme fatigue. Cognitive decline. Frequent infections. Breathing and circulation changes. These 5 signs often appear in the year leading to the end of life. They don't always come at once. They may not be obvious at first. But once you begin to notice them, it's the body's way of preparing for its final transition. For families, accepting these changes is never easy. It's natural to want to fight against them, to encourage more eating, more movement, more strength. But sometimes, the kindest act is to stop fighting the inevitable and instead focus on peace, comfort, and love. Understanding these signs isn't about fearing death, it's about preparing for it. When you recognize them early, you can offer better care, make decisions in time, and ensure that your loved one's final months are filled with dignity and compassion. This is the time to share stories, make memories, and let them know they are valued, right until the very end. If you're noticing these signs in someone close to you, take a deep breath. Remember, you're not alone in this journey. Many families have walked this path before. And while it is never easy, knowing what to expect can give you strength, patience, and peace. Thank you for joining us today. Please leave a comment below sharing one thing you learned, and how you plan to use it. Reading your thoughts gives us motivation to keep creating content that informs and supports you. If you found this video helpful, don't forget to like, subscribe, and share. Your support helps us continue bringing meaningful content to guide and inspire you. We look forward to seeing you in the next video.